Greetings. I'm Dr. J. I'm here on behalf of Nature's Alkaline Way and Nature's Pharmacy. Dr. Bill Reddy, acupuncturist extraordinaire. He is one of the go-to people among the acupuncture community of this area. He's just coming on the IG Live now. And Bill, I was just saying that you are one of the go-to people with regard to acupuncture. And I think we should start by telling people what acupuncture does, especially in regard to heart health and overall health. But what does acupuncture do?
So, it's such an American question to ask because people always want to know the details of that. And really, the mechanisms are not terribly understood when it comes to cardiovascular health. There's some ideas about a nitric oxide increase, which will cause vasodilation of the blood vessels, and then that'll drop blood pressure. There's definitely some studies looking
and favorably influence blood pressure without making the blood pressure go too low. So yes, actually, I think there's a fair amount of information that isn't well known about how acupuncture can favorably influence stress hormones, and that can favorably influence the heart and the blood vessels. Nitric oxide, as you mentioned, very important and very accessible through the piezoelectric phenomenon called acupuncture. When someone comes to you and they have a little bit of high blood pressure and a little bit of swelling in their feet or a little bit of pain in their chest, acupuncture looks systemically. Acupuncture looks globally. But it also has local effects. And I wonder if you have any of those that we might discuss.
So when it comes to someone coming into my office who, let's say, wants to get off of their blood pressure medication, it's outside of my scope of practice to make that decision for them, and a physician has to do that. And so it's a little bit tricky where I would have to work closely with their physicians, and in the past, the physicians generally are not interested in working closely with me.
Oh, that's interesting. What I recommend is that consumers be proactive, that they get an Omron or similar blood pressure device, either upper arm or wrist. The wrist is easier to use, but read the instructions and follow them. And so I have the same issue. I pay a lot of attention to certain things that most cardiologists don't pay any attention to, and what they pay attention to, I think, is an artifact and really not meaningful. Specifically, I don't care what your cholesterol is. I don't care what your triglycerides, your HDL and LDL. I don't care. I care whether you have oxidized LDL. I care whether you have oxidized cholesterol, because that will harm you. A little bit of oxidized fat buried in a large amount of innocent bystander fat. Cholesterol is the source of hormones. Cholesterol is an innocent molecule. Cholesterol has gotten a bad rep because of the Levy-Fredrickson diet heart hypothesis, which was disproven 25 years ago or more. So yes, in regard to diagnosis or in regard to therapy, a therapeutic decision to discontinue a blood pressure medicine should be made on the basis of knowing what the blood pressure is. And if through stress response and acupuncture and relaxation response and dichromatic green light and whatever, you get your blood pressure down to the point where you don't need the medicine, it is then more than fair to go to your doctor and say, doctor, look at what my blood pressure is. It's below 120 over 80. Do I need this medicine anymore? Because every high blood pressure medicine wastes magnesium. And magnesium balances calcium and is essential for heart and vascular health. So I agree. We don't preempt the territory of the physician to make a diagnosis and to invoke therapy. What I want is for consumers to be proactive enough to work with you and work with us so that they no longer need the medicines.
Certainly, I think that's the step in the right direction, you know. And if you go to the like the American Heart Association, it doesn't talk anything about microinflammation, which I know you're incredibly aware of and done very deep research into, and it's completely ignored. And they do mention a little bit about diet as far as trying to help with cardiovascular disease, but you know, every 34 seconds, you know, an American drops dead from cardiovascular illness, so it's certainly no joke.
No, it's no joke. It is certainly number one or number two in terms of taking lives. But Paul Dudley White, who was President Eisenhower's physician and still very active when I was a student, he pointed out in the 1930s at Mass General Hospital, if they had one heart attack a year, they published the case because heart attacks were so rare. 30 years later, with a change of diet, lifestyle, and stress, cardiovascular illness became the biggest scourge, the biggest taker of life, mostly related to diabetes and weight. I think you know, Bill, and I will disclose to our audience, I used to weigh 65 pounds more. About 10 years ago, I lost that weight. I'm not going to find it again. I feel and function much better. I get restorative sleep. And I see my acupuncturist regularly for a tune-up.
You know, the point about sleep is really huge because the York study, which you're very well aware of, that huge longitudinal study in England, they looked at government employees, and they found that if you have 1 hour less sleep than your colleague, you have twice the chance of dying from any kind of cardiovascular event, and about 50% greater chance of dying from any other thing, from falling asleep at the wheel, etc. But it just demonstrates that poor sleep will actually increase inflammatory markers in our bodies. And once again, if you look at the Heart Association, they don't mention sleep at all, and we both can agree that that's a huge aspect of general health and well-being.
Now, we did at a recent American Heart Association meeting show some of the data that we have achieved in regard to cardiovascular health, especially blood pressure, using magnesium and choline citrate, because magnesium turns out to be an antioxidant that protects essential fats when they're in transit, like LDL and HDL. Ron Aline, one of our magnesium experts, has shown that if you're in the lower half of the serum magnesium value range, you're chronically magnesium deficient. It's called CLMD, chronic latent magnesium deficiency. If you're in the upper half of the serum magnesium range, you are sufficient and protected. The point you made is profoundly important. The leaders of the American Heart Association grew up with a misunderstanding about cholesterol, a misunderstanding about particles and HDL and LDL, and just a profound misunderstanding. And to this day, they can barely spell inflammation, which is really repair deficit, and repair deficit creates atherosclerosis. Repair deficit creates coronary artery disease and the risk of stroke and heart failure. And if you happen to carry a few extra pounds or kilos in your abdomen, what we call visceral fat, think of Mr. Pickwick, that adds to the problem. In fact, it may profoundly create the problem. Now, we did, as you know, an outcome study in type 1 diabetes and type 2 diabetes, and we showed, compared to best standard of care with the ADA, American Diabetes Association, we showed a full milligram% reduction in hemoglobin A1C in just 6 months in the community, making best efforts to follow our guidance. What does that mean? That means we added 20 plus years of quality life, probably at low cost. So we can, with lifestyle, greatly influence heart health. For me, acupuncture is part of that process, has been since I studied with Qing in the 1970s. I think of acupuncture as a way of being well and enhancing my well-being. I really, for lots of reasons, I don't think of it in terms of diagnostics.
Agreed. And I think that, people, when they're slightly out of balance, that's what the acupuncturist does, is we're trained to identify what that imbalance is and rebalance it. And one of your watchers was asking about what are the downsides of acupuncture, and there are side effects that include better digestion and sleeping more deeply. However, in terms of adverse events, if someone is poorly trained, we can puncture a lung, so that's called a pneumothorax, and then the lung won't inflate properly after that, and you have to have a physician go in and remove that air in the lung pleura to get to be breathing okay. It's rare, but it does happen. There are some cases in China where organs are punctured, and that can lead to some problems. In the past 60 years in the US, there hasn't been a single death directly attributed to acupuncture, so it is very safe. An average malpractice insurance for an MD is about 60 grand a year and up, and for us, it's $75 a month. So it demonstrates that we're just not getting sued. As a matter of fact, the most common lawsuit against an acupuncturist is with the TDP lamp, which is a far infrared lamp. They're poorly made in China, and there's a hinge point that if acupuncturists don't snug it up, it will slowly lower, and they leave the room, and it gets closer to the patient and will burn them, and they can get second and third degree burns, which, if someone's face up, it's relatively easy, just nudge it aside or whatever, but that's been the issue. Also, if you look in the literature, there are people that will say there's bleeding at the site of needling, or there might be a bruise at the acupuncture site, which again is no huge deal. People at the Shark Cancer Center were concerned about people having blood thinners, and that they may be contraindicated to use acupuncture, and studies have shown that the bleeding is not increased with blood thinners, which goes against our common sense, but they're very, very tiny needles.
Hair fine needles.
Yep, stainless steel, used once and discarded. For those folks who wonder, sometimes if you give blood at the US Red Cross, they will ask if you've done acupuncture as a potential for getting hepatitis. And there's no chance of that because we can't transfer the illness to another person because we don't reuse the needles. So, and they also ask about tattoo parlors because they don't clean their needles properly, and they can, in fact, transfer hepatitis. So it's just colorful, and we have to educate.
A little anecdote about hepatitis. In the 1970s, it was noticed that heroin addicts got the kind of hepatitis that exists in the Middle East, in contrast to the kind of hepatitis that exists in North America. So Harvey Alter, who won the Nobel Prize eventually, asked me to get from the DEA samples of street heroin which we were going to assay for hepatitis virus. Now, the chemistry of translating poppy juice into morphine or heroin is very harsh. So I assumed, notice I assumed, that we wouldn't find anything. And we did. We found not only hepatitis antigen, Harvey was able to get this material and inject it into monkeys, and they got hepatitis. So we published that heroin addicts should avoid sharing needles. If you don't share the needles, you won't transmit the hepatitis. If you do share the needles, it's roulette. So that subject of hepatitis and needles is near and dear to my heart, because I think it was 76 or 77 that we published this article, which did change behaviors. Needle exchange programs grew out of what we did.
Well, circling back to you're talking about the magnesium, is that about 60% of Americans are magnesium deficient, and it's because we beat up our soil. And if you don't have the magnesium in the soil, you can't have it in your food supply. And what I typically like is transdermal magnesium, because it's magnesium chloride, because it really gets through the skin and it has no negative bowel effects.
Well,
I think
that's an option, but we also recommend that people take magnesium, 220 milligrams of elemental magnesium with a teaspoon of choline citrate that triples the uptake. And this is actually what we reported at the American Heart Association meetings a year or so ago, was the fact that with choline citrate, you correct the choline deficiency, you alkalinize using citrate, and you more or less triple the uptake of magnesium. So however you get it in, you need it. Yes, at least 60, maybe 80% of people today are deficient in magnesium. And as I said, if you're in the lower half of the serum magnesium range, which is an easy test to do, although it's often overlooked, if you're in the lower half of the serum range, you're deficient chronically. And if you have, if you're in the upper half, I congratulate you, you are sufficient. But as you pointed out, magnesium is water soluble and controlled by the kidneys, also by the sweat and stool. So you can't get too much magnesium. You can have too little and have adversity, but it's very hard to get too much.
Thank God for small favors. One of the things that they were postulating about acupuncture and cardiovascular health is its effect on mitochondria. And again, they were able to do some studies, but they weren't incredibly conclusive, but they definitely demonstrated that we're able to, they call it neuromodulation, that, that one of the questions people ask is, are we putting needles into nerves? Are the acupuncture points nerves? And the answer is no. There are nerve plexes that correspond to some acupuncture points in the body, but that's not entirely the case. And that some suggest there was a study called Acupuncture for the Treatment of Cardiovascular Diseases in 2019, a systematic review. About 80% were positive for blood pressure reduction. They started out with something ridiculous like 500 articles, and by the time they excluded non-clinical trials and dates of publication and only English speaking, it dropped down to about 16 studies. And they were evaluating what it was. And so pericardium 6, which is a point that people are aware of for seasickness, but it's also used for cardiovascular health. And they say that it's innervated by the vagal and sympathetic fibers. And so they're suggesting that there may be some relationship with the vagus nerve as well, because the vagus nerve innervates the SA node, and then also the left vagus innervates the AV node.
Mm-hmm.
So
I though am impressed with the work of Bruce Pomeranz, who showed that acupuncture is piezoelectric and information carried on the collagen fibers, not nerves, collagen fibrils. And we extended that by looking at the embryology of what's called the notochord. The notochord becomes your spinal column. The notochord sends out sentinel cells to every differentiated part of the body. And when the embryo is growing, it constantly is turning and twisting, which may actually explain the acupuncture channels. So I'm quite confident at this point that acupuncture is piezoelectric and it's carried on collagen fibers. There are secondary effects on hormones. There are secondary effects on nerves. There are secondary effects on blood pressure, but they are secondary.
Yeah, that's great. And the whole fascial planes thing, which is really coming into vogue, demonstrates that the distal aspect. How is it that you can place a needle at someone's ankle and there's some kind of communication to their neck and it releases their neck? And again, it has to do with collagen fibers and twirling the needle. So when you see acupuncturists twirl the needle, there's an actual effect. And like you said, piezoelectric as well. Also, they talk about micro trauma, that just if I were to randomly stick a needle into someone at a non-acupuncture point, there's still a systemic effect because your body recognizes that it has been penetrated, and there's anti-inflammatory stuff that goes on as a reaction to it. All of which but
the body has remarkable capacities for self-healing. And in a sense, acupuncture is a minor wound to the body that calls attention to something, hopefully with the needle in the right place to have a systemic effect as well as a local one.
Precisely. Even something like a tennis elbow, for instance, a lot of times under the tendon, you can get some blood because of that irritation. And that with the needles, you can puncture that and help release that blood and increase blood flow and get that out. And so there's sometimes where we do actually needle the structure, whether it's tapping on knee cartilage for osteoarthritis to physically needling a ligament or tendon.
And interestingly, acupuncture needles need to be made of two different kinds of metal. There is something called the Kelvin-Thomson law, which says if you have two different kinds of metal and you put a needle into a point, there will be a flow of microcurrent. Very low, very small, not what is called electroacupuncture, which I don't recommend. But this Kelvin-Thomson law explains part of acupuncture.
And usually in the presence of an electrolyte, then you have a further potential difference or voltage.
And if you reverse that by putting moxa on the outside and warming it, you can reverse the flow.
And so the Chinese will also use other materials in needles like gold and silver, and they believe that gold has more of a tonification and then silver has more of a reduction aspect. But they're a little more ancient. You still can't get your paws on gold and silver needles, but we American acupuncturists tend to stick with stainless steel.
Amen. So what do we want folks to take away from today's conversation about acupuncture and health, acupuncture and heart health? But if there's one or two things that are most important for people to understand about you and about acupuncture, what would that be?
So in terms of heart health, definitely, so heart failure is something that we can increase the strength of the squeeze of the heart, which is pretty great. AFib is something that's becoming more common. I don't know what's exactly driving it, but definitely that's something that acupuncture is very effective at treating. And then blood pressure, again, we can modulate it, but we would have to work very closely with the physicians in order to get that. And just in terms of general health and well-being, my patients will just say, my stress is lower because it lowers cortisol levels. You know, I'm sleeping better because we can stimulate melatonin release in our brains. People who have a lot of anxiety, it's because, well, some people believe that it's because of low serotonin levels, and we can increase them as well.
Exactly. And through saliva, you can now measure stress and other hormones. You can restore sleep by following a sleep induction ritual, which we have in our book, How to Thrive in the 21st Century. I recommend How to Thrive in the 21st Century because the 21st century is challenging. There's lots of challenges, but there are also opportunities. And we want to emphasize the opportunities for lifestyle, including acupuncture, and know that you can actually measure things like stress and other hormones in saliva if you want to confirm that you're feeling better and functioning better. They go together. I get up in the morning having had restorative sleep, excited about what I'm going to do each day. I consider myself very fortunate to be able to do that. I'm sure you do as well. And we do the best we can to spread the word that you can follow nature's pharmacy and nature's alkaline way and thrive in the 21st century.
Agreed. And I think that in the Taoist approach, it says that if you can live in the rhythm of nature, you're happy and healthy. And yet a lot of us are living in an area where there's artificial light, and so we end up staying up later in the wintertime when in fact we should go to sleep earlier in the wintertime because that's what our biorhythm requires. And you know, the Japanese doing the forest bathing, that there's a lot to be said for just being outside. And actually sunlight exposure will increase nitric oxide, and you can drop your blood pressure by 10 points just by sun exposure alone. So there's a lot to be said. You can look up a heliotherapy and see the value of that.
Or you can use a green dichromatic light, which we have written up in the book, How to Thrive in the 21st Century. So there are many self-care tools that you can engage and document that you not only feel better, you function better for life. So thank you for this. Thank you for all you do to help speed the transition from sick care to health care or healthful caring. And thanks for acquainting us with a little bit about acupuncture and the wonderful world of a philosophy of relativism rather than a philosophy of reductionism. I'll leave that for the next time that we have a conversation, but thank you so much for being who you are and for what you do day by day.
Thank you, Dr. J.